virtually for the November Kane County ROSC meeting. So we're going to start today with our brief introductions. We'll go over the agenda and we'll have a quick icebreaker. So let's just review the agenda.
I'm going to share the screen, get it up and going. Now, I would like to say thank you to, we'll thank Gateway properly here in a second, but Annie has been gracious enough to let us use a hotspot for this. So here we go. Let's do it. Agenda's ready to go.
So we're briefly going to do the welcomes and introductions. We'll go into the Thanksgiving icebreaker that gives everybody an opportunity to participate in their life. We're going to spotlight again Gateway Foundation Services. And we'll also give a Kane County Community Needs Assessment update. And then we will speak and announce the new unveiling of the Kane County Mobile Outreach Van.
Can we get a round of applause for that?
And then we'll have community connections where we'll have announcements and a few flyers of what's going on in Kane County. And then we'll open up for discussions, any Q&A.
Perfect. You want to do the icebreaker? All right, so we always try to do an icebreaker. Sometimes they go well, sometimes we get like 2 people. But this one's about gratitude. So I think everybody here should have something. So Annette, do you want to introduce it?
Sure. So in the spirit of the upcoming holiday, we'll start with a moment of shared gratitude. So we know that our work is challenging, but it is also filled with hope and small victory. So we invite everyone to participate and unmute the mic or, raise your digital hand. And we are asking for a brief to complete this brief sentence. A recent moment of hope or connection I'm thankful for in our recovery community is
blank. So think about that. Or if it's just something that you have some gratitude for, especially, like we said, tough times. Sometimes the holidays are tough for people in recovery. It could be tricky. So I think it's important to highlight, like she said, the positives and the gratitude. I will say this, I'm so grateful for the team I have with me. I've been going out and doing ROSC work for the past few years, same so as Annette. I'm so blessed to have a team that we can go out and be able to do things like this every month is really, really special. So not only our team, but the organizations that host us month after month. Not only that, but engage with our programs, collaborate with us. So I'm grateful for all of you. I know that sounds cliche, but truly this organization like this or a coalition like this does not work without your buy-in, without your engagement. So I'm grateful for all of you. So thank you for being here. So if anybody has one they want to say, we've got the game show mic style. We can go around and so you can raise your hand, or if you're online, you can raise your digital hand and I'll try to get you. So whoever wants to start, I know there's a lot of gratitude in this room.
Hi, everyone. I'm Annie Dorst. I'm the Director of Professional Relations here at Gateway Foundation. And I actually just celebrated my 1-year work anniversary with Gateway as of yesterday.
Woo!
I'm very grateful for that. It has been such an honor working for Gateway. And I have to say, just working out of this location for the out of the office here starting on Monday, and just to welcome the new patients that start treatment with us has been just so cool to see the incredible work that the whole team is doing. So very grateful for the Aurora team, doing some work that they're doing. And I also just want to say I'm really grateful for my daughter. She is 5 months old.
Oh, nice. We'll have to see some photos later. Before we go, I saw Ben Rudolph's hand up. I saw your digital hand up, Ben. Do you want to come off mute?
Yes, I do. I have a silly one that I'm grateful about, but I am grateful. It's a person that I encounter a couple times a day. I live in Peoria, Illinois, and I live 2 blocks from a nice park. It's called Laura Bradley Park, and it has like a 2 or 3 mile walking thing that I like to walk in. There's a young man there, a chubby, young African-American guy who wears his hat backwards and he's on a little cart, like a little golf cart, and he never seems to do any work, but he drives around the park all around through the whole circuit. And whenever we encounter each other, he gives me this incredible smile and he salutes me. And I don't know what this kid's deal is, but he just knocks me out. And I look for him. And while I'm walking through the park, right, it's like a 45-minute walk, we encounter each other like two or maybe three times. And he does the same thing. And I'm like, oh my God, I love that. If you're in a bad mood, this guy will take you right out of the bad mood thing. And for the first
Amazing.
time this morning, I saw him actually doing work. And I was like, oh my God, you're doing work. Anyway, he's just the cutest thing. He's just the cutest
Thank you,
kid.
And if you guys don't know, Ben Rudolph is the technical advisor that the state and Chestnut Health Systems has working with us in this area. So you will see Ben sometimes in person, sometimes his digital head. But yeah, he will be a regular in these meetings. So glad to see you, Ben. Any
Grateful to
other
receive.
gratitude things people want to chip in with? Okay, I do see a hand.
And so essential clinical supervisor here at our new work. One of the things, especially with the holiday season, and I'm not just saying it because Lucy's sitting here, Lucy's our alumni coordinator, is I'm incredibly grateful not only for our alumni team, but also our outreach. It's getting harder and harder to seek treatment, to get into treatment. Our patients are facing so many barriers within their communities. So being able to actually get them into treatment and have that outreach team to get them here, but we can only do so much work in the period of time that we have a patient in residential and an outpatient. And so Lucy and Troy really run our alumni program, every program here at Aurora. And they do so much incredible work to the patient responses, getting them into treatment as soon as humanly possible, getting them back where they feel safe and welcome, but also having these incredibly lovely revitalizations, recovery lines that our patients go to. I've never seen a recovery here in Aurora from our patients. So, and the patients that come back to bridge group and everything like that, 6 months sober is just really incredible. I'm incredibly grateful for that stuff.
Amazing. Thank you. And we're going to talk to a couple of gateway folks a little bit. Everyone today has been so gracious and awesome. They had built the home as soon as I walked in. Thank you. Let's have a gratitude day. I see a hand up, and then there's somebody else. We'll get to Adam. I see Maureen online.
Hi, everybody. Can you hear me?
I think you're muted. Yep.
Me?
Oh, now you're muted. You were good before.
Oh, there we go. How's that? Yeah. Okay. Hi, everybody. I'm Mo. I'm a community engagement specialist at Footprints to Recovery. I started a few months ago. I moved back to Chicago in June. And so I'm just sort of getting the lay of the land. And I am really, really grateful to be here. And I'm just starting to learn about all these different areas and different resources. And I'm really grateful to be doing the work and meeting everybody. So thanks for having me today.
Beautiful. Thank you, Maureen. Nice to meet you. Anybody else here? Adam, you got one?
This time of year really is filled with a lot of introspection, a lot of thinking about this sort of thing. Getting another year older, or my anniversary in public service that we're celebrating this year. Or the passing of my sister is a catalyst to get into this work. And I am absolutely incredibly happy to be working with such a world-class team of people, because our work really truly spreads with white flowers and black. And when people see the work that we do, hopefully it's going to continue to spread, and that is incredible.
Wow. Thank you, Adam. And we got some more chairs. People need one. Was there anybody else that wanted to maybe say something quick, gratitude online or in person as we get more and more people filing in?
So I just want to share, I just want to say again, this community, I'm very grateful for this community, especially, we just started the Kane County ROSC, and the attendance has been amazing, and the support, it almost makes me want to cry. I just want to say how welcome, the Kane County ROSC has felt, and how embraced we feel and wanted and supported in this community. So I am so very thankful for each and every one of you guys, because I know that I talk to each and every one sometimes, and sometimes I don't, but I am very grateful to each and every person in this room and all your organizations and all your support.
Amazing. I know we got a lot of stuff to do. We got one more hand up, and then we can get into the next thing. So, Ellie, from the wonderful Live for Lolly, our great friends Live for Lolly. What do you got?
Hi everyone, my name's Ellie. I'm an outreach coordinator for Live for Lolly. This is my first ROSC meeting I'm attending, so grateful to be here. Just something I'm grateful for. Right now we're in unprecedented times. There's a lot of financial constraints and resources that are being taken away. But I gotta say, like within my community, my friends, family, just kind of everywhere, I've seen a lot of innovation and a lot of just creativity of like being able to come up with reusing things and using things for different purposes. And just, I don't know, there's a lot of creativity, and there's a lot of, I think in hard times, we see a lot of people getting crafty and like coming up with new solutions for problems. And it's been really cool to see kind of while we're in a hard times that there is some really cool things and creative approaches to solving problems in a different way and repurposing things and bringing together community in a new way. So grateful for that.
Amazing. Glad to have you here for your first ROSC meeting.
Thank
All right.
you.
Well, thank you to everybody. We talked about gratitude. Nat, you want to kick us into the next thing?
So we'll move on now to the wonderful services here at Gateway Foundation.
Where did she go? She was right here. I looked at you like you were Annie. I'm so sorry. It was very bizarre, I know. Do you want to come down here, Annie? We can talk for a minute? Yeah.
So the Gateway Foundation's legacy of evidence-based care provides a critical foundation for our ROSC network here in Kane County. And so it is our distinct privilege to introduce Annie to ROSC. Perfect.
See, I told you were going to nail it. Yeah. She was worried. I was like, no, she's great. Yeah.
And Annie will have a brief overview of their services and impact.
And we're going to talk to some members too. And I have to say, right before this meeting, what was that? 1 minute before the meeting started, a special member came because there was a gentleman who was here who was the counselor at the very last treatment center I went to. And so to have him here for this was such a full circle moment. And if you work with me, I get emotional around work stuff sometimes. I was like full on, like 30 seconds before the meeting was going to start. So it was a good cry, but that just goes to show like it was a good hug. But like how small this recovery world is, and the people that we meet coming back around to different places is really crucial. And it's those relationships. And I'm really, really glad we could have this time here with you. We have great relationships with Gateway, and you have a lot of great staff here. And I'd love for you to talk about some of them too. So I'm going to give you this microphone, and I'll stop talking for a bit.
Well, hello, everyone, again. I'm Andy Dorista. I'm Director of Professional Relations here at Gateway Foundation. I just want to welcome you all. This is our large IOP program, as we call it. And I just want to thank Jared and Matt for the opportunity to host this meeting today. As many of you know, the Gateway Foundation has spent more than 55 years helping individuals with substance use and mental health disorders. And over that time, we've had the privilege of serving over 1 million adults.
With an M.
With an
1 million.
and counting. We have 16 locations across Illinois in virtual programming, and we remain committed to making treatment accessible for everyone. This location, Gateway Aurora, was established in 2005, and it offers residential treatment, day treatment, intensive outpatient programming, virtual intensive outpatient programming, recovery coaching, and alumni support. Our residential services include our Recovery Advantage program, which is a alcohol-specific program. And we also have a dedicated male residential unit. We accept most major insurance plans, including HUD. I also just want to highlight our incredible clinical outcomes. This is a true testament to our staff. We have a 91% satisfaction rate.
Wow.
And we have a 95% satisfaction rate in our outpatient. To Jared's point, I also just want to acknowledge the holidays. This is a time where, you know, it can bring up a lot of stress for people, heightened emotions. And I just want everyone to know that if you or someone you love needs help, I just want everyone to know that we are here. We're here to help, so you can reach out to us anytime. And then I want to introduce our Gateway Foundation Aurora team. We have Sam Ortiz-Hughes.
Yeah, we can put them on the spot if you
yeah,
want. You know?
Sam-
These are wireless mics. These are wireless mics. We'll make sure. There you go.
So I oversee that for my until now. I don't do it. And I started as a principal supervisor and moved into the program director role. And I love it. I live about an hour away, so I live here every day. Work with a really, really great team. So starting at admissions and working our way all the way through our outpatient programming. Patients are really good with their disorder. So we have 44 bed residential facility, 18 bed med unit. So we have a 16 bed all gender full current unit. So diagnosed substance primary, mental health secondary, and then we have 10 bed alcohol specific instead of recovery units. So each of our units works with the specialized curriculum to implement. So full curriculum to implement we can start on. And then the concept like right there to recovery. We really try and involve them with our programs and treatment from the get-go. So making a phone call with 24 hours of food that's here. We say, the person is there, we'll say, and I asked him when he wanted to pay for the application for them. They were doing the right things. When we got to figure out what I'm supporting. So that residential programming is usually about 20 to 35 students. Usually we need residential treatment on the phone thing. So ideally, IOP, we like people to step down to our IOP program. If you don't live near us, figuring out where you get what I do. Usually in the therapist, psychiatrist, primary 1% access to medications and therapy. One should be done because that's because we want to have them focus on you. On our outpatient side, we offer more interactive. We offer 2 different types of clinics, so more interactive. And then we do full Monday on basic outreach. So we have 4 different things. So we've got much going on here. But as I said, how do some projects, right? So we're trying to figure out how to move support for women and it's involved. I think it's really fun time. As a change the way institution works or we should have natural framework. And they want it, and it's happening to find. And then occupying and certain that really are working at the original.
So real quick, just a heads up. Anybody online, I think there's someone said they were having a little trouble hearing. The connection is just a little laggy, so we'll just try to make sure those online. Everybody here, we had a great large group in person, but those online, if you're having trouble hearing, there's just a little bit of lag, that's all. I have a quick question for you though, because I was trying to find like the human connection behind things. So how did you get into this field?
So I'm not in recovery, but I love someone who is.
Okay.
I love a lot of people or who are in addiction.
Yeah.
So, you know, I've known from I was a kid that I wanted to be a social worker, that I wanted to help people. That's kind of what led me. Nonprofit is where my heart is. I worked in a couple different sectors, but substance use nonprofit. And honestly, as crazy as it sounds, residential is where I really love to be.
Beautiful. All right. Do you have another member? Yeah.
I want to highlight a few members.
Please, absolutely.
Courtney. Courtney is our clinical supervisor.
Courtney, yeah, introduce yourself. Sometimes here's the only issue with two wireless mics. Sometimes like I'll forget that I don't have it, and then so you may have to just introduce yourself again for the people online.
I actually started here just over a year ago. I started as an uncredentialed counselor one of the unit.
Nice.
I actually started my work in the field in beautiful, sunny San Diego, California. Now,
But you love it here now, right? Ah.
Yeah, I've been here for just over 8 years. David, that's the funny one. Basically, my bachelor's, my master's, my CNBC, LSW, LCSW, and Scott. All of which
That's a lot of letters. It's a lot of letters. Okay, well, it's great to meet you. Yeah.
And
What else we got?
So Vince
Let's do it.
C is our alumni coordinator extraordinaire.
Alumni coordinator extraordinaire Lucy. Actually, I got to meet Lucy outside. She has a great vibe about her. I got a great feeling from talking to Lucy.
I mean, so for being the alumni coordinator, we're option position. I am an alumni of Kane. I came to the program in 2011 myself. I became a volunteer here in 14, and from 2014 to 20, I was hosting about 50 meetings a month. And today I am an alumni coordinator / recovery coach. I get to go on the people since we become friends. We become family. It's a really nice fit for my job when I do it. I get to see them on the table. We get to go to recovery, we go to events, we get to go and have coffee with them. The phone rings, I get to talk to we get to connect them to people in the community. We have people in the room come back in and a friend and care from today for company. We get to share, and that's what I said earlier. For me, it's a really nice connection with someone that be there. My phone break, my neighbor phone, personal phone. I choose to not be anonymous because I'm so blessed today to have recovery. Where I started 14 years ago and where I'm at today is completely different. When I get to share the finances, when I got here, I came here to find walking there. And I have that picture, and I share with people that there's a piece of hope. Where I started is not really happening. We have to continue the money. Grab the hand, grab the phone, do whatever you got to do. This is a unit. I'm so grateful.
It's amazing. Yeah.
I'm grateful for that.
Yeah. Wow. Thank you, Lucy.
And I'm gonna put just 2 more people on the spot.
All right. We'll put a couple more on the spot. Do they know they're getting put on the spot? All right. Wow. A lot of stuff happening with the government right now. Yeah.
but I'm a very new grant director for music, so it's my first time on this site. So ready to all of you.
Beautiful. Great to have you here.
And then everyone has goodie bags.
Yes, they do.
So in the goodie bags, you have our service grid with all of our locations, all of our programs, and then our admissions directory with all of our direct access to our admissions.
Yes.
Enjoy, and the popcorn too, enjoy the popcorn.
Now, I have something to give before we move on to the next segment. Some of you may know, I'm going to announce this, but some of you may know that Serenity House is the lead agency for the Kane County ROSC as well as the DuPage County ROSC. And this is the 40th year anniversary of Serenity House, if you can believe that. Went in.
Yeah.
Started as a 4-bedroom house in 1985, has now grown to service hundreds of people each year, both residentially and outpatient. And we have been gifting our partner sites and those people in leadership positions with commemorative coins, which I'm not going to show off. I'm going to let you distribute to your leadership team. But I do want to show for the camera, so for the people who aren't here, sometimes this works well, sometimes it doesn't. You can see it's got a great ROSC logos on the front and on the back. Serenity House, 40 years, bam. So I want to hand these to you because I'm not sure how many you have here today complete, but I want to make sure your entire leadership team and coordinatorship has them. So can we please give a round of applause once again for Gateway?
Thank you so much.
All right, I am going to stop talking and I'm going to let the coordinator talk about some other stuff. We're going to do assess our survey.
Well, everyone, I know I might sound a little bit like broken tape recorder, right? About our community. But the Kane community is live. It's been live and will be for over a month, 2 months now.
Yeah.
And so we are still advocating and asking all our partner organizations to be there the information. I think we share to our folks with everyone, and if we haven't, please reach out to us because we will be we can email them or we can call to your site and bring them to you. And talking about sites, I'm just going to take this moment to introduce one of our newest members at Serenity House because she will be coming out to your site. Julie, are you ready?
Now, can I say something real quick? When I interviewed Julie a couple months ago, one of the things she said to me, I was like, "Are you good with outreach?" And she goes, "I was a North Shore hairdresser for 20 years." I didn't know what that meant right away, but I've come to learn that it means yes, she can talk, and yes, she can do outreach. And so you'll be seeing Julie quite a bit. And so, but she has a great story, like all of our team. Those of us in recovery or those of us with a loved one in recovery, we find ways into this field. So I thought we'd just chat with you for a couple of minutes. So Julie, tell us, what does North Shore hairdresser mean in the world of recovery? And make sure that mic's on if it's not.
It's hi everybody. North Shore hairdresser in recovery. I had some many dark days, but the longer I continue down that dark path of using and abusing, I feel like I broke my career away. And but there's that hope, and I'm still a great hairdresser with colorist. And I still do hair. It's been a long journey, but I haven't been active in the salon for almost 11 years, and I just was floundering out there, and then I just knew one day I was done, in and out, I was done, and 4.5 months later, I started the Certified Recovery Support Specialist program at Elgin Community College, and I'm still there 3 years later, working on my associates in applied science and UC, and you know, after 38 years in active my addiction, now, I mean, this is what I'm meant to do. I'm so grateful to be a part of this team, and to learn about ROSC and get out there and communicate in the community and collaborate and have that conversation, you know, about recovery and what can I do to be a part of the bigger picture and to provide that hope, that support. And so I look forward to working with all of you. So thank you very much.
Beautiful. Welcome.
Thank you for the introduction. So again, the Kane County Community Assessment, the data that we collect, is very important. We are going to develop a report that will help guide our collective priorities and help us identify where to focus. And on that note, now that we are here and we have a few minutes to chat, I think we can. I just want to ask our members here that are present with us if you know, what barriers, you know, have you noticed that we might be experiencing here in King County? I know that we're very rich with services in King County, but there's always something, you know.
There's barriers that come up. Like when we were like creating some of these programs, we would run into barriers we like didn't even think about. Sometimes it's like I desperately want to go to treatment, but I have a dog at home and I cannot go. And truly, these are family members to people. You know how it is with pets. So what happens with them? You know, why are they not allowed, or why can't they have the same access to treatment? Because they have that barrier. Or transportation. People take for granted how easy it is to drive themselves to treatment or to have somebody to take you. Full disclosure, when I was out there, I didn't have anybody to take me anywhere. And there was some lonely walks to some places. So there's those things we take for granted. And some of those things will be on this assessment, you know, when you take it yourself. But as Annette said, the conversation here is about, you know, we don't know, and y'all are out here and see a lot of these barriers. So it might be good just for a few minutes to kind of have an open conversation. Those of you who are out in the field, which is most of you, let's hear it. What are you running into? It could be financial, it could be, you know, structural, it could be language based. I would love to hear from y'all. So I'm going to leave this QR code up on the screen just for people could take photos of it if they need it. But again, we'd love to hear from you. If you want to raise your digital hand, or if somebody in here would like to start, we can go that way. So however we want to do it. And not all at once. I say that joke every time. Okay, great. And you can introduce yourselves too if you want.
Hello, everyone. I'm Nicole Demori, and I'm a licensed clinician, a certified alcohol drug counselor, and I'm very involved in the community with treatment placement and everything. I formerly worked at Gateway Foundation here as well in Aurora in the admissions department, so I'm really happy to be here. I think the thing that is most pressing that I found difficult in both, really, I mean, historically working in the behavioral health field is all the elements, like you said, that lead up to that access or speed to care.
Yeah.
And it's a time sensitivity. We have those conversations and those sayings about, you know, we got to strike while the iron's hot. And that's true and that's beneficial. And then what? And how do we do that? One of the main barriers with that too is medical complexity. And so a lot of my main partners in the community are coming through hospitals, and it is 24/7, 365 care, or there is like a centralized area. Maybe they're not in this state where they're taking their calls, but it's this come on down effect. Like we don't take appointments, just come on in. And they're talking about reducing that as a barrier. However, to your point with transportation, funding, insurance, they can get there, which is a lift, but then they get there and oftentimes they're being turned away because all the other stuff wasn't predetermined or discussed. The comment that I think still pains me so much is, we really want to help them. However, they just look horrible on paper. And we ask for those records, those details, the symptoms, the facts, right? The evidence to apply the evidence-based treatment. And with my time and my experience at Gateway, that was the number one thing that we were looking for, and that what they look for day in and day out, and actually what is really helping build on those programs. I think Sam and Courtney were able to speak to it so well. It's not evidence-based until you have that evidence. And it means getting those people that are on, maybe look bad on paper and bringing them in and getting your eyes on them and getting them in the building to appropriately assess. Having them to even get through connected to admission sometimes is a big issue.
Amen. Thank you. That's great. That's great feedback. Anyone else? Again, you can just raise your hand and we'll get the mic around to you. While we're waiting, I can talk about some other ones that like kind of we've run into in our own work. You know, we talked about the transportation, we talked about some of those other things. Obviously, insurance, now that's shifted a little bit with some things being accepted, but you know, that's tricky too. I think navigation of resources. The thought experiment that I do when I go to like maybe colleges or high schools, pull out your phone and Google rehab near me, and then look at the first 12 to 15 things that you get back in that search. Those are all sponsored. So if you're somebody who's attempting to get into treatment for the first time, and all I think to do is, okay, I can Google it. Good luck, because if you've never navigated some of those things, you can get lost in it, and you can get frustrated and say, you know what, not today. Tomorrow I'll go to treatment. You know, and as we all know, very short window sometimes of them being willing to go. So that's an example of a barrier that we see. Yeah, I'm just trying to keep the conversation open. Is there any other barriers y'all have faced that you'd be willing to talk about? Because the point is we talk about them to try and solve them as a group too. Okay, yeah. And online too, I know that there may be a little lag, but if you raise your digital hand, we can get you on too.
With all of the medical complexity and the case management, seeing patients who are coming in with higher need for mental health, higher need for substance use, higher need for support, that there aren't a lot of the case management agencies out there that we can really partner with. I've seen some AAD tags in here. We work a lot with AOD. We love our threshold case managers. We love our cornerstone case managers with the agencies that we have been able to work with. But patients have to meet certain needs levels, and there are wait lists to be a part of those programs. So we do everything that we can to make sure that our patients are set up for success when they step down to care with us. But some of our patients really need that full-time case manager to help them keep making appointments, make sure that they go to those appointments, get those text reminders that we're just not able to provide. And so that's been a big need, especially over the past year. We've really seen it here that's impacted our ability to continue to provide those wraparound services.
Wow. Okay. Good feedback. Great. And anyone else? Adam.
I know we've heard a lot with our Narcan distribution, some of the apathy. Oh, that doesn't affect me, so I don't need to worry about it. And I think if I had $1 for every time I've heard that, I'd probably be retired something on a big screen. You know? And so there's that, the apathy. And also, we've got a lot of resources out there, but people have trouble navigating those resources and figuring out what they are. Maybe they just that could be a big book of the resources.
We're sort of in motion with that. Just full disclosure, if you don't know, or if you haven't seen it, in a neighboring ROSC that we do DuPage, we put out a resource guide last year that's about 13 or 14 sectors, and it's about as deep in detail as you can get. The problem is, like you said, I would love a physical copy of it. The physical copy of it is like, it's massive. So we're trying to figure out a way to whittle it down to a manageable level. But if anybody ever wants access to that, just let us know. We'll be happy to send it out to folks. But we're looking to do similar stuff here in Kane with that resource guide. Yeah.
Yes, we are. So we are actually through the ROSC developing a resource guide. So we've been collecting, and that's another reason why we're asking, the community to please share, with our community surveys. We want to be able to identify those barriers or those obstacles, and we want to be able to create, resources and how to navigate them and how to make them not barriers anymore, obstacles. So that's why it's so imperative to hear from everyone, especially here, in Kane County, because the service is for Kane County.
And I can also say it's also important to get people who have nothing to do with recovery to take it. All of us, we know how to take those things because it's like, oh, I wrote this, so I know how to answer this. Somebody who maybe has no connection to recovery at all is sometimes some of the best input because that's like a true community member. And it's gauging what they know about their community as far as like what's out there. So if you know people who have no connection to this, please give them the link to this because we would love to see it. I did see a hand up online. Ben, did you have your hand up?
Yeah, I did. In a past life, I did assessments for a local hospital for drug and alcohol treatment programs. And I was, I guess the bottom line was that to try to streamline the assessment and admission process. At least at the hospital I worked at, it was a long process. There were a lot of questions to ask, and it's really difficult to do that with a person who is withdrawing from something like, say, heroin. When the drug is kind of calling them, and I've only got 40 more questions to ask you before we can get you to see the doctor. And I always wondered if there was some other way to streamline this assessment program so that as a guy who did assessments for a while, I had many people who just said, I can't do this anymore. I got to go. And they'd run out of the room. They just leave because we couldn't move quickly enough to get them a bed, to get them into detox, to get nurses and doctors in front of them, to get them assessed properly and put into a program.
That's a great point. That's a great point. I think that speaks to the timeliness piece too, like the willingness to enter services in that very short window. So that's why, initially, another thing that we talked about kind of creating, because out of necessity, how many of you like engage with the WhatsApp thing we do? The WhatsApp? Okay. There's a few of you. I know Iris is in the mix too, but the WhatsApp we kind of created because there wasn't anything like it a few years ago. Basically, Becky's like nodding her head. You won Refer of the Year, I think. Yeah. Yeah, give her a hand. Oh my God. Yeah, please. Becky Sadler from Rosecrans does great work. But in those, just even the WhatsApp, because Iris wasn't up to the level it's at now. I mean, we were doing like 8, 9, sometimes 10 referrals, helping each other in the same day, sometimes like within an hour or two. So that was just all professionals that were like, oh, we gotta get people in quicker. How do we do that? So we started to do group text, and then now there's like 160 people on it. So it's really helpful. But I think it's a great example, and we'll talk to Michelle. We'll talk to about like building something because it didn't exist out here. So we can look at barriers. We look at assessment questions and say, hey, what can we do to build programs to meet these needs out here? So Michelle.
Recovery or resources for people recovery, and thinking about that, I know that the health department, people don't think of the health department as like a place to go.
I know, it's odd.
That provides direct services, so I did that. But while we don't provide direct services, we want to be as connected as we can to the people who do, and like you said, it is a rich environment as far as services go within the county. And to that end, we just started that Behavioral Health 360, which I think is really great, a great tool for people that, maybe they're just living in the things, but the fact that it has local resources and all kinds of other kind of resources for people, I think is great. But then also I was thinking to myself, like, a lot of people don't even know what behavioral health means.
Yeah.
So that's just kind of the things that are coming to my head. But yeah, like, I think if people knew that they could go to the health department to get information about Gateway, and whatever else there is out there, that would be great. Instead of like thinking, oh, I know about Gateway, or I know about Serenity House. Or whatever.
That's great. That's great feedback. Yeah, absolutely. Anybody else? Okay, we do have about like 13, 14 minutes left. We got to cover a couple things, but hopefully if we have a little time at the end, we can revisit some of this. I mean, we're going to be revisiting this constantly because we're going to be identifying, what those gaps were, barriers. We can break them down, then we'll find the next one, right? But we can only do that together by doing this stuff.
So please share the survey, with your organizations, in your newsletters, with your neighbors, with your own family members and your coworkers. again, it's a way to collectively figure out what our priorities should be. So we're really gonna appreciate if everyone can, share the information.
What do we got next?
So next,
Do you want to mention the special thing for the people who are here in person after the meeting? The van that's up parked outside? I thought that was next on my agenda.
okay. So then, now that we've had this conversation on some obstacles and barriers, we want to introduce and we want to announce, and I'll let Jared take it away from.
No, you can announce it. Because you have the proper verbiage right in front of you. Make sure that I don't mess anything up.
Okay, perfect. Okay, so a major announcement that we would like to make here at a Kane County ROSC meeting is the very purpose of what our council likes to champion, collaborative initiatives that can and may fill critical gaps in our community's system of care. So today we are proud to help introduce a new resource for Kane County, the Kane County Mobile Outreach Van.
Clap.
So this van is a direct result of a powerful partnership between two of our member organizations, AID Cares and Serenity House Council Services. So the ROSC is proud to have helped facilitate this connection, and we celebrate their commitment to launching this very vital service. So
Let's say after the meeting proper, everybody who's here in person, we actually do have the van here. We're considering it kind of like a soft launch because it's not until next week that it's going out. But we staged it. We have everything in there like we're going to have it out at the sites. AID is obviously the biggest partner with that. That was originally some of the source, the reasons for the funding, but also the city of Aurora has been helpful with that as well, to Serenity House and AID. It's great just to have another mobile resource like that. Anybody who's done unhoused outreach knows that it's quite truly meeting them where they're at. It's not pressuring resources or services on people. It's being there to listen and to kind of see what their needs are. And AID has been doing amazing work for so many years. We've only started partnering up, meaning Serenity House, in the past year or two. And so to have that extra partnership now is amazing. So after this meeting, we will be doing, I call them tours, but it's just the inside of a van. But it is kind of a tour, right? That's still a tour. Okay. Yeah. So please, one more round of applause just for AID and Serenity House for getting that rolling. Last thing I'll say, and I'll stop talking, there will be updated information on like where that van will be, like during the week, different locations. And then if you're into like, hey, there's this spot over here, they let you park that there on Fridays. We're looking to have those conversations too. So we can only find those locations and break down barriers together. So y'all know some great hidden spots, I'm sure. We'll talk. So yeah, it's harm reduction supplies. We've got some warm weather clothing. We've got toiletries, food. We've got some warm blankets, warm clothing. We've got water. Yeah, sleeping bag. Like pretty much anything for someone who would need to be sleeping outside, especially if it's colder, could use. So
wound
care stuff as well.
We have first aid kits. We also have supplies for pets.
Yeah, that
Because we
too.
have to remember that, some unsheltered people are out there with their pets. So we have some blankets and we have some dog food and, some of those,
Do we have the paw booties?
not yet,
Okay.
but we will.
We're trying to.
Yeah, but we will. So yeah, we also have some of those kind of items for, because we want to think a little bit out of the box. So.
Well, it's barrier thinking, right? Like if we talked about the pets being a barrier, or a barrier to entry or something. Yeah, a lot of unhoused people have their pets with them. And we don't think about that enough. But yeah, after this meeting's over in about 10 minutes, we'll take you out and we would love to show you the inside of that. So yes, you can.
Just two things. One, is it intentional to have it start like launch next week and Thanksgiving?
That's just the next AID pop-up event, I believe. to where we would have it in action. But that's kind of symbolic though.
Yeah, right?
Yeah. I promise you we didn't plan.
And then like, is it primarily in Kane County? And then, okay, great.
Kane County and yeah, this is where it'd be primarily serving. Yeah. Any other questions about that? The man who made me cry is looking at me through a window. All right, I'm gonna stop talking. Do you want to get into the rest of the events and I can stop talking here?
So now we'll move on to our community events, right? And announcements and upcoming events. So we have the ECHO Development and Stable Able Housing present the annual Thanksgiving dinner. It'll be Tuesday, the 25th of November from 11:30 a.m. until 1:30.
That's a great lineup of food.
It's a
Very-
community event, and there'll be speakers at that event. So
Again, holidays are rough. If you know people who are spending it alone or need something like this, please let them know. Next up.
then we also have from our friends at the Kane County Health Department, Saving Lives with Firearm Restraining Orders. A tool to prevent gun violence will be hosted virtually in December on the 9th and the 19th. And more information can be located through the Kane County Health Department community calendar.
Got some QR codes up there. So if you're interested, you can go ahead and get set up for that.
And lastly,
Speaking of AID.
Their pop-ups events will be on Tuesdays in Batavia, Wednesdays in Aurora, and Thursdays in Alger. And you can also find this information up on the Kane County Department's community calendar.
And last but not least, nothing. It's blank. Sorry about that. Actually, this is the time where we invite y'all. If you have events you would like to promote, or a program that could use a little support, what are your needs? I'm going to go digital first. I did see Bridget Flanagan has her hand raised. Bridget, I'll let you go.
Hi, everyone. My name is Bridget Flanagan, and I am here along with my colleague Karen to tell everyone that we are trying to open a recovery high school for adolescents here in Aurora.
Wow.
So I don't know how familiar everyone is with recovery high schools, but there are about 40 across the country. There are none in Illinois. There's one in Indiana and one in Wisconsin, but those are the closest. A recovery high school is a place for adolescents in recovery from substance use. They attend school in a sober environment. They get all of their academics. They meet state requirements, but then they also have an opportunity to work with social workers and recovery coaches and job coaches and work on life skill things. We eventually would like to work with community agencies to do job training, job shadowing, doing internships and all of those things. So we've been working on this for about 2 years, and we are slowly and surely making our way there, but we would love support from anyone and everyone. I don't know, Karen, do you have anything else you want to add?
No, I just was
I have a
waving.
question.
That was me. That's all.
Oh, okay.
Oh, we might have a question for you, Bridget. Hang on.
And I just wanted to ask, like, obviously a regular high school is supposed to be substance free, but like, what does a recovery high school look like? Like, can we talk a little bit more about that?
What does it look like?
Like, how is
So it's regular high school as far as academics. Traditionally, they're very small. Like the quote largest one is about 150, 200 students. So academically, there would be teachers teaching all of the subjects, meeting all of the state requirements. But then, like I said, there are times for meeting with social workers. There are times for meeting with recovery people. There are times for doing kind of like adulting, learning things. It's just a place and space where adolescents in recovery can find other people like them and figure out how to do life sober with other people that are trying to figure out the same thing. It's a way for them to make connections, replace some of those social pieces, and learn how to be a productive member of society, I guess, for lack of a better way.
Yeah, and to make sure that they have a safe space to make a mistake and have people there to support them when they do, if they do too.
Yeah.
Yeah, we want it to be a place where they will come to even just to socialize or even just to come and hang when they're done with school.
Yeah, actually, that's so cool. Because so many of us started substance abuse in high school because so many of us don't know how to socialize without substance abuse.
Right.
So that's important and that's good work. Honestly, thanks for clarifying.
Amazing.
If you want to learn more, I put my email in the chat up at the beginning. But also there's a great documentary on Netflix called Generation Found. It follows students and staff at the largest recovery high school called Archway Academy in Houston, Texas. I'll put my email back in the chat.
And put the name of that on the
Go ahead.
Netflix on there too.
Are these residential or are people going home at the end of the school day?
We, in the beginning, will be just a day program. I would eventually like to add a residential component. We have to start somewhere. So we've decided to just focus on the day program school piece of it for right now. But eventually we would like to expand to have, I don't know, some sort of, small unit that we could keep students there who maybe are coming from far distances or maybe don't have a safe home environment to go home to.
Right. Yep. Our dream would be to be a public school and to be able to take kids from any walks of life and not just
Beautiful.
people that
Well,
can
thank
pay.
you for sharing that.
Okay.
That sounds like a very noble effort and idea, and it's something that's definitely needed. So we'll keep an eye on that. Got about a minute left, so I'm gonna let Annette take care of the rest.
So thank you everyone that came out today in person and who is with us virtually. We really appreciate your time. And we want to make our last announcement. Our next Kane County ROSC meeting will be in December. It'll be December the 17th. We are actually going to be having our holiday events. And this year, Jared,
We're gonna do both DuPage and Kane together. So it'll be a dual holiday party at Serenity House on December
I
17th.
think the theme is Jared.
And the theme is, I don't know, what was the theme? I forgot. Oh my God. Okay. This year is the first annual ROSC Awards. I'm giving out community awards to people, so do not snooze on that. There's gonna be some great awards. This is always a fun event, slightly surreal. 2 years ago, I had COVID, so I led the party on Zoom from my bed. We're not gonna do that this year. We're all gonna stay healthy through the new year. So the 17th, join us at Serenity House for some food, some fellowship, and yeah, just take a load off of the holidays. Let us entertain you for a day.
Thank you, Jared. So please join us. We appreciate everyone again. We want to be respectful of everyone's time. So everyone who is joining us virtually, if you want to just make sure you get everyone's emails, have everyone's information. And again, this meeting is adjourned. Happy
Thank you to
Thanksgiving,
Gateway
everyone.
again.
Yes,
Thank you to
thank you
Gateway for hosting. And whoever would like to see the van, it's right out here. We'll be out there shortly to start doing some walkthroughs.
Also, excuse me, anybody who hasn't signed in, the clipboard is down.
Everybody
there.
online, thank you so much. Great to see you. Thanks
Happy
for stopping
Thanksgiving,
in.
everyone.
Thank you.
Appreciate you.
Pretty close to meeting the chat.
I guess. Let me just.
Information. I didn't sit in the high